Hi, Howard Deal here with the General Agency, and today I will be covering the ACA penalties for 2022 and how those penalties can affect both the employer and the employees. So remember, if you like this video, hit the like and subscribe button to keep up to date with more videos to come. The Affordable Care Act applies to employer groups of 50 or more full-time employees or groups that have 50 or more full-time equivalent employees. So if you're a large group employer that has, for example, 30 employees and a number of part-time employees, those part-time employees count as full-time equivalent employees. So to calculate that, what you would do is you would look back on the month and say, okay, how many part-time employees do I have? And you would add up all of their hours and divide them by 120. It sounds complicated, and it can be. So if you have questions, be sure and contact one of our brokers, and we can do the calculations for you. So let's say, for example, you have 30 full-time employees, you already know that, and you have a number of part-time employees. If you add up all of the part-time employees' hours for that month, divide it by 120, that will give you the number of full-time equivalent employees. So you may be over 50 full-time employees, even though you only have 30, but you employ a number of part-time employees. Now remember, full-time employees are employees that work 30 or more hours per week. So let's go over the penalties for 2022. The penalties for 2022 are as follows. Penalty A is $229.17 per month, or $2,750 per employee. Penalty B is $343.33 per month, or $4,120 per year. And the affordability threshold is 9.61% of an employee's salary. Now the affordability threshold of 9.61, to calculate that, what you would do is you would take the lowest paid employee's salary and multiply that times the 9.61. That will give you the minimum contribution for the lowest paid employee, and that will keep you safe as far as the affordability threshold. If you need help calculating that, be sure and call us here at the General Agency and we can help you with that as well. Now keep in mind, these penalties are per employee per month. So if a group has 50 employees, you would multiply 50 times $229.17, which would give you a monthly fine of $11,438.50. And annually, 50 employees would be fined on penalty A for $137,500 for the year. So the solution to getting out of penalty A is to offer a minimum essential coverage plan, or a MEC plan. And these MEC plans can be purchased for as little as $50 an employee. And sometimes you can have the employee contribute part of that cost. So offering a MEC plan is a good solution to get out of penalty A. The fines for penalty B for a 50 life group monthly is $17,166.50 and annually $206,000. So it's important, if you're not in compliance, to set a plan up right away to get you into compliance to avoid those fines. The solution to getting out of penalty B is to offer a minimum value plan, and this can be done by offering a group major medical plan, a regular group major medical plan, or an individual coverage health reimbursement arrangement, or ICRA. It sounds confusing. It's really not that difficult, but if you have questions, you can contact your broker, or you can contact us here at the General Agency and let one of our brokers help you. Now let's go over how employers are being reported to the IRS. If one of your employees goes to the exchange and requests a subsidy, one of the questions on their application is, does your employer offer affordable health care? If the employee answers no, it will ask, what is your employer's name, phone number, and that kind of information. Now, the IRS will go back and look and say, okay, is this group 50 or more employees or 50 or more full-time equivalent employees? If the employer is, then that will trigger, and the employer will have to prove to the IRS that they're offering affordable health care. There's also a number of filing forms that are done each year with the taxes that say, hey, we're a large group employer and we do offer affordable health care. But if that employee answers no, and the group is a large group and not offering health care, these penalties will be imposed. Now, if an employee answers no, they don't offer affordable health care, when in fact the employer does offer affordable health care, the employee is going to have to repay back the subsidy money that they've received from the government. So it's important that your employees know that they cannot misrepresent that information on healthcare.gov, or they will be, the subsidy money they received will be recovered by the IRS. It is very important that you understand the ACA and the effects it could have on your business. So if you have any questions, be sure and contact us here at the General Agency and let one of our network brokers help you. And once again, hit the like and subscribe button if you like this video, and have a great day.